Understanding blood transfusions. Blood transfusion is a critical medical procedure involving the transfer of blood or blood components from a donor to a recipient. This life-saving practice addresses various medical conditions and emergencies, playing a vital role in modern healthcare. This comprehensive overview covers the history, types, indications, donor selection, compatibility testing, transfusion process, potential risks, and future trends in transfusion medicine. Historical perspective. The history of blood transfusion dates back centuries, with early attempts often resulting in adverse reactions and limited success. Key milestones in the development of blood transfusion include 17th century. The first recorded blood transfusion attempt took place in the 17th century when Dr. Jean-Baptiste Denis transfused sheep's blood into a young boy. This experiment had limited success due to the incompatibility of different species' blood. 19th century. Advancements in understanding blood groups and compatibility began in the 19th century when Karl Landsteiner discovered the ABO blood group system in 1900. This discovery laid the foundation for safe blood transfusion practices. 20th century. The 20th century witnessed significant progress in blood transfusion, including the development of blood banks, refrigeration techniques for blood storage, and the introduction of blood component separation methods. Modern era. Today, blood transfusion is a well-established medical procedure with stringent safety protocols, sophisticated testing methods, and a reliable supply of donated blood. Types of blood transfusions. Blood transfusions can be categorized into various types based on the components of blood being transfused and the purpose of the transfusion. Whole blood transfusion. Whole blood contains all blood components, including red blood cells, RBCs, white blood cells, WBCs, platelets, and plasma. It is used in cases of severe blood loss due to trauma or surgery. Packed red blood cells, PRBC, transfusion. PRBC transfusion involves the infusion of concentrated RBCs, commonly used to treat anemia, blood loss, or to improve oxygen carrying capacity. Platelet transfusion. Platelets are crucial for blood clotting. Platelet transfusion is performed for individuals with low platelet counts, often seen in patients with leukemia, chemotherapy, or certain medical conditions. Fresh frozen plasma, FFP, transfusion. FFP contains clotting factors and is used to manage bleeding disorders, liver disease, and coagulation problems. Cryoprecipitate transfusion. Cryoprecipitate is rich in clotting factors and fibrinogen, making it valuable in treating bleeding disorders like hemophilia or von Willebrand disease. Granulocyte transfusion. Granulocytes are a type of WBC involved in fighting infections. Granulocyte transfusion is rare and typically reserved for patients with severe infections and compromised immune systems. Indications for blood transfusion. Blood transfusion is indicated in various medical situations, including hemorrhage, blood loss due to trauma, surgery, or medical conditions like gastrointestinal bleeding may require transfusion to restore blood volume and oxygen carrying capacity. Anemia. Patients with low hemoglobin levels, often caused by conditions such as chronic kidney disease or chemotherapy, may require PRBC transfusions to alleviate symptoms like fatigue and weakness. Hematologic disorders. Individuals with disorders affecting blood cell production or function, such as sickle cell disease or thalassemia, may need regular transfusions to manage their condition. Coagulation disorders. Patients with clotting disorders like hemophilia or liver disease may receive FFP or cryoprecipitate to improve clotting factor levels. Bone marrow disorders. Leukemia, lymphoma, and other bone marrow disorders may lead to low blood cell counts, necessitating transfusions to support treatment and improve quality of life. Surgery and organ transplants. Blood transfusion is often required during major surgical procedures and organ transplants to replace blood loss and support recovery. Medical emergencies. In critical situations, such as severe trauma, sepsis, or acute gastrointestinal bleeding, immediate blood transfusion may be necessary to stabilize the patient. Donor selection and blood compatibility. Ensuring the safety of blood transfusion relies heavily on selecting suitable donors and matching blood types to the recipients. Donor selection involves rigorous screening and testing procedures to minimize the risk of adverse reactions. Donor screening. Health assessment. Donors undergo a thorough health assessment to rule out conditions that could affect the safety of the donated blood, such as infections, recent travel to high-risk areas, or medication use. Lifestyle questionnaire. Donors are asked about their lifestyle choices, including sexual activity and drug use, to assess potential risks of transmitting infections like HIV or hepatitis. Physical examination. A physical examination may be performed to check for any signs of illness or infection. Blood compatibility. Blood compatibility is determined primarily by the ABO and RHD blood group systems. The ABO system classifies blood into 4 major groups, A, B, AB, and O. The RHD system classifies blood as Rh positive or Rh negative. A compatible blood transfusion is crucial to avoid severe adverse reactions. ABO compatibility, blood type compatibility is essential. Type A individuals can receive Type A or Type O blood, Type B can receive Type B or Type O, Type AB can receive any type, and Type O can only receive Type O blood. This is known as the universal donor, O negative, and universal recipient, AB positive, concept. Rh compatibility. Rh compatibility is crucial for Rh negative individuals. An Rh negative person can receive Rh positive blood once, but further Rh positive transfusions may lead to sensitization and adverse reactions. Cross-matching. In addition to ABO and Rh compatibility, a cross-match test is performed to ensure that the recipient's plasma does not contain antibodies against the donor's red blood cells. Minor blood group compatibility. There are numerous minor blood group antigens, and matching for these antigens is important in certain cases, such as in the prevention of hemolytic disease of the newborn, HDN. The blood transfusion process. The blood transfusion process involves several crucial steps to ensure the safe and effective transfer of blood from the donor to the recipient. Patient identification. Accurate patient identification is essential at every step of the process. This includes confirming the patient's identity using 2 unique identifiers, example, name and date of birth. Blood collection. The donor's blood is collected using sterile techniques, typically from a vein in the arm. The collected blood is then processed to separate the desired blood component, such as PRBCs, platelets, or plasma. Compatibility testing. Blood samples from the donor and recipient are tested for ABO and Rh compatibility, as well as cross-matched to ensure a safe match. Transfusion. Once compatibility is confirmed, the blood component is transfused into the recipient through an intravenous line. The process is closely monitored by healthcare professionals to detect any adverse reactions. Post-transfusion monitoring. After the transfusion, the recipient is monitored for signs of adverse reactions, such as fever, chills, or shortness of breath. Documentation. Accurate documentation of the transfusion, including the type and volume of blood component administered, is crucial for medical records. Conclusion. Blood transfusion is a cornerstone of modern medicine, offering a lifeline to patients in need of blood or blood components. The evolution of transfusion practices, from early trial and error to today's sophisticated and safe procedures, reflects the progress of medical science. Understanding the types, indications, donor selection, compatibility testing, and the transfusion process is vital for healthcare professionals and the general public alike. This knowledge ensures that blood transfusions continue to save lives while minimizing risks and adverse reactions, ultimately contributing to the well-being of patients worldwide.